This summer marks the 10th year anniversary of the ALS Ice Bucket Challenge. The ALS Association says 17 million people participated in the challenge, raising $115 million. And today we're joined by registered nurse Maureen Reid and Dr. James Grogan, a muscular neurologist from Penn State Health and ALS United Mid-Atlantic. Thank you both so much for joining us.
Thanks for having us.
Yeah, thank you so much. Thank you so much for being here. So let's do a brief reminder for the folks who may have forgotten or also folks who don't know, what exactly is ALS, if you can remind us?
Sure. So ALS, or amyotrophic lateral sclerosis, or Lou Gehrig's disease, is a disease where the motor neurons, the nerve cells that control muscles, become damaged over time and die. And this leads to people getting weaker, difficulty with pain, swallowing, weight loss, all kinds of things that eventually need our help.
Yeah, well, taking it back 10 years ago, I think a lot of people remember that Ice Bucket Challenge, and I know one of the main things was raising awareness. If you think about it now, 10 years later, how effective was it in raising awareness? We also heard $115 million was raised. Where did that money go to from that challenge?
Sure. So I think one of the big challenges with ALS is that it can take up to a year for someone to get diagnosed after their first symptoms come up. And all that time, they could be receiving care on medications to slow the disease. So raising awareness so people at least know what's out there and then know how to get help, I think really does make a difference.
Yeah, Nurse Reid, can you talk a little bit about, again, the fact that there is not right now a cure for ALS. Where are we right now in the research to finding that cure, and does it look like it's going to happen soon?
Well, the money that was raised from the Ice Bucket Challenge really helped going towards research and helped us to have the Healy platform trials at Penn State Health. And through that, we were able to discover a drug, which is
also, and a number of drugs,
for
including
COD1, for our patients who have SOD1 gene. So it's a familial ALS. So we finally have something to treat that. Which is huge, but also too the money that was raised also helps patient care. So through the ALS Mid-Atlantic, that's who I work for, and I've been a nurse there for the past 14 years. The money goes towards patient care services. So we purchased in-home equipment for those patients who have equipment that the insurance doesn't cover. And there's a lot of that, like power wheelchairs, lifts, all mobility assistive devices.
Well, you read my mind, because that was the next question I was going to ask. How does that organization help people living with it? And describe it for us, because there are people out there who are still learning what ALS is. There are people out there who may not know someone with ALS. Talk about what you've seen people go through, what you've seen your patients who you help. What is it like to live with this particular disease?
Well, I also have a personal history because my late husband, Rich Kelly, passed away from ALS in 2003. And he lived with the disease for 5 years. And that's how I became very acquainted with the Penn State Hershey Medical Center Neurology ALS Clinic. And they were fabulous. Anyway, so the first time I meet an ALS patient is the diagnostic visit. And during the diagnostic visit, we form a bond. So whatever nurse, because there's 4 of us, are part of that diagnostic visit, they become our patient, and we're the patient care manager. And they know that when they call, they are speaking to somebody who is very knowledgeable with ALS, empathetic, and they know that they aren't alone. And that's very important, because it's very scary to be given a diagnosis that there is not a cure. So our goal is to help them with their best quality of life while they're living with the disease.
Well, we thank you so much for what you do, and I know that there's a push to do this challenge again now 10 years later. So talk a little bit about it. Do you think that that could happen again? And if it happens, would it be as effective as what happened in 2014? Do you think the money would be raised? Do you think it would increase awareness? How do you think that would work in 2024 versus what happened back in 2014?
Well, I would hope so. And I think part of it, and I mean, I think we all remember doing it. Like, I was an intern meeting with the nurses from the ICU to help celebrate one of our patients who had ALS. So being able to do it then, post it on Facebook, raise awareness that way, I think made a difference in then trying to raise money. So with social media as it is, I think it'd stand a good chance to try and do something more.
Yeah, well, thank you both for what you do. Nurse Reid, Dr. Grogan, thank you so much for all your work and for coming in today.
Thanks for having us.
Thank you, Michael.
Thank you both. Let's meet back over to you.
Michael, thank you.